So the next trial I was about to discuss as well is the Medalist Trial, a study which has been published this year in the New England Journal of Medicine in, again, lower risk MDS patients with ring sideroblastic phenotype, randomizing luspatercept versus placebo. The trial met its primary endpoint, being transfusion independence for at least 8 weeks in the first 24 weeks of treatment, and this led to the registration of the agent not only in the US but also in the European Union this year. So I think it's a great advantage also for these ring sideroblastic patients. So the Medalist study also had several secondary endpoints, which also included biomarkers of response. And for instance, one of the posters revealed that patients with a rather expanded erythropoiesis by bone marrow morphology had a higher response rate compared to patients with less expanded erythropoiesis, again emphasizing that the drug works as an erythropoiesis maturating agent, so promoting late stage or terminal differentiation of erythroblasts in the bone marrow. Also, studies with regards to quality of life were performed, which did not show an overall significant difference between the luspatercept and the placebo arm. However, there were some segments where luspatercept seemed to improve also quality of life in these patients. So I think the take-home message here is, at least with the methodology used in the Medalist trial, the drug does not put additional harm on the patient. It does not deteriorate quality of life of patients being red blood cell transfusion dependent. So the next steps, of course, for the Medalist trial and for the drug itself, luspatercept, will be to maybe combine it with other agents being active in MDS. And I think some of the studies are already underway.